One more important topic regarding pharmaceutical inorganic chemistry is short note on radiopharmaceuticals. What are radiopharmaceuticals? That we already know. Radioactive materials which are prepared and used in treatment as well as diagnostic purpose in medicinal field are radiopharmaceuticals. They are specially designed products that are used therapeutically for treatment and diagnosis of various diseases, disorder as well as deficiencies. Now, what does they do? Radiopharmaceuticals distributed in the body, then they emit radiation. These are mainly destructive radiation, means they will kill the abnormality or abnormal cells. These radioactive materials are afterwards photographed to detect internal injury, abnormal cell growth, like in case of X-rays and various imaging, brain imaging, thyroid imaging studies. Now, ideal properties of these radiopharmaceuticals. What kind of properties should they have? Only gamma rays should be emitted by radiopharmaceutical, as alpha and beta can't be easily detected and require in high dose. Gamma emitting or gamma radiation emitting radiopharmaceuticals are preferred, but they are more harmful too. So, beta emitting particles are preferred as radiopharmaceuticals. Now, this energy of gamma rays produced should be between 100 to 250 kilowatt. Now, less than 100 will not produce any pharmaceutical effect, and more than 250 it will produce toxic effect. Example, iodine 123. Now, it should have higher efficacy in low dose. So, in low dose, it should produce required therapeutic action. It should be less toxic to patient, should be readily available and inexpensive. If it is not readily available or costly, it cannot reach to market or to normal people. No complicated equipment required for preparation as well as detection and manufacturing of this kind of radiopharmaceuticals. Now, what are the hazards or what are the disadvantages of radiopharmaceutical? They liberate peroxide, which cause alteration in DNA sequencing, leads to induction of cancer. Now, they also adversely affect embryonic development, means they also affect pregnant women's children. Lactation also be affected, so it should not prescribe while or prescribe to pregnant women as well as lactating women. Now, what are the precautions for handling of these radiopharmaceuticals? If liquid material, it should be handled using tray with absorbent tissue paper. Then rubber gloves should wear that person who is handling this radiopharmaceutical. Mouth operated pipettes use should be avoided. Smoking, drinking, eating at that place should be avoided. Shielding device which can block radiation passing out should be used. Then it should be stored in well labeled container and in remote corner, not open spaces. Then area should be under visual monitoring, and disposal should be done very carefully. Disposal means its removal. Now, storage conditions. What are the storage conditions? It should be stored in airtight container in shielded place with bricks, and should be stored as per AERB, Atomic Energy Regulatory Body's guideline, and pharmacopoeia guideline. should be used within short period of time. Expiry date should be clearly mentioned and it should not lose its purity while storage. Now, this is very most important question, that application of radioactive substances. You already know what are radioactive substances. Now, radioisotopes, these are the atoms with unstable combination of neutron and proton. Now, classification: stable as well as radioactive. Stable isotope will not emit any radiation, and radioactive or unstable isotope will emit radiation, like uranium and radium. These are naturally occurring, and rest of the material we are obtaining from synthetic procedures. These are the various isotopes. In iron, in case of iron, unstable or radioactive radiation emitting isotope is Fe2655 and Fe2659. Rest of these four isotopes are stable, means they are not emitting any radiation. Now, what are the therapeutic application of this radiation? Generally, these radiations are of destructive, means they are breaking down our cells. So, these are destructive type radiation. So, they are basically utilized to destroy abnormally grown cells. So, generally used in the treatment of cancers. What are the factors we will see while selecting this radioisotope is which type of radiation they are emitting, then energy or strength of this, intensity of this radiation they are emitting, then targeted tissue, which is the targeted tissue, like if it is kidney or it is GI tract or it is heart, right? Then characteristic of selected radiation: if it is alpha particle, then it is heavier; beta particle, then it is lighter than the alpha; gamma is more lighter. Likewise, characteristic also should be considered while selecting these isotopes. See, there are two kind of application, that is externally and internally. Externally, they may be given in the form of teletherapy, implantation, or surface or contact, and corporeal irradiation method. Now, what is there in teletherapy? They are directly applying to the affected areas. See, these are the example: cobalt 60, cesium 137. These are given by teletherapy, means targeted area, they are provided directly to the targeted area. Then implantation: here radio isotopes are sealed in some material and then they are implant on targeted tissues, but this is external application, we are not providing them inside of our body. Now, surface or contact, in that they are basically used to treat various types of skin cancer, ophthalmological tumors, and dermatological applications. These extracorporeal irradiation type are used to determine depletion of lymphocytes in blood. So, whether there is deficiency or decrease in lymphocytes which are present in blood, to know that we are using this extracorporeal irradiations type of isotopes. Furthermore, example, phosphorus 32 type of isotope of phosphorus is used in treatment of granulocytic leukemia. This is blood cancer, type of blood cancer. Then yttrium 90 is used in treatment of multiple myeloma, bone cancer, and iodine 125 is used to treat deep-seated tumors, chest, like in chest. The second one is internal source, means these are provided inside of our body using infusion method, or interstitial implantation, or selectively absorbed or concentrated amount of this isotope is given in our body. These are various examples you have to remember. Now, the diagnostic application. Two types of application we have seen. First one is therapeutic application, and the second one is to diagnose the disease or to examine various organ. We are using these radiations. Like technetium 99 is used for brain imaging. Thallium 201 is used for heart imaging. Then iodine 131 is used for thyroid imaging. Technetium 99 MSc gastric imaging, and technetium 99 is used for bone imaging.